Hi, my name is Chelsea, and I will be doing my medication administration test out today. So first, I will start off with hand hygiene. So I already grabbed my MAR, looked over that, and once I finish this, log into the med dispense cart. Okay. Okay, so now I will select my patient, James Wilson. There he is. Alright, so it alerted me that he is allergic to NSAIDs. Okay, so first, I will dispense the hydrochlorothiazide, 50 milligram. This will be me doing my first check. And I did check the MAR. He's not allergic to that. 50 milligram tabs. Just need one. I will be doing the captopril. Okay, I have the Reiten med. He's not allergic to that. Got 25 milligram tab. Just need one. I'll do the NPH insulin. Just need one for that. Now we will do regular insulin. Now the influenza vaccine, which we got his consent prior to. One of those. That is it for the 8 a.m.s. And he is not in any pain, nor does he have any constipation, so we wouldn't give any of the PRN medications. So now I'll open the drawer. There we go. Okay, so first I'm taking out the hydrochlorothiazide, 50 milligram. Checking the expiration date of this. It is not expired, so we are good to go with that. All right, I'm also checking the dose, 50 milligrams. Hydrochlorothiazide, perfect. So I will close this drawer. It won't let me. Okay. Also, I realized I maybe should have a tray next to me so the meds don't fall on the floor. Okay. Let me look at this. Why is this working? Okay. So now I'm getting the Captopril, 25 milligrams. Checking the expiration date as well. Doing my first med check also with this one. Okay, so now we'll open the insulin, NPH insulin. Checking the expiration date. It's not expired, so we can go ahead and use that. Doing another check. Are good with that. Now, the regular insulin. Not expired, so we can go ahead and use that. Now the flu vaccine. Checking the right dose also. 5 milliliters per dose. Also, it's not expired, so we're good to go with that. Let's do one more check. Perfect. Let me try to figure out this drawer real quick. Okay. It says, please remove any contact from the monitored border area. Okay, I'm just trying to figure out how to close this drawer. Okay, so now I cancel that item, now that I have the drawer closed. Okay, so we are good on that. Have all of my meds right here with me. So I will log off. Perfect. So now I can go over to, my, prepare my medications. All right, so I will use this little tray here. Just the oral medications. The injections. Grab that hand sanitizer also. I'm just gonna push this over so I won't. All right. keep the oral medications in their packaging until I get to the patient's bedside. But just for now, I put a cup there. Okay, so now I will prepare the insulin since that is first on the list. Got my syringe. And some, whoops. Some alcohol wipes. So you can see what I'm doing. There we go. Okay, so first, just gonna do this one more time just to be safe. So first I will draw up the regular insulin. Wiping off the top. Oops. Put that there. Ripped off the top. And then, just to double check for the sliding scale insulin, the blood sugar was, that's not right. Thank you. The blood sugar is 169. Okay. So that means I will add 2 units with sliding scale insulin. He's already getting 5 units of insulin. So 5 plus 2 would be 7 units of regular insulin. All right. So I wiped off the top of this. And now I'm actually going to have the NPH as well, so I can pump some air into this before getting my regular insulin. Okay, so now that both caps are wiped off, then I'd open up my cap, or my syringe. So I got some air into my syringe. First, I will try to pierce this, push some air in. I probably should have started with the NPH since I was starting with the regular. We start with the NPH to put air in there since I'm starting with the regular. So, regular has air in it. So now I can draw up the 7 units. Also doing a double check that I have the right meds here. On this. All right. Trying to flick out the little bubbles. My hands are a little shaky too, so that doesn't help. Just one bubble that does not want to leave. Okay, there. Now that we finally got that bubble out. So now I am going to recap this insulin because I need to roll up my NPH insulin. Just going to set that down right there. All right. Since I touched this vial, I'm going to wipe off the top again. Okay, so now that that is all good to go, doing another double check. He gets 15 units of the NPH, so we're at 7, so it'll be a total of, we're at 7 regular insulin units, plus 15 would be 22 total. Adding 15. This one went a lot better than the other, bubble-wise. Perfect. So now I can recap that. And can you confirm that this is 22 units? Sorry, I'm a little shaky.
You're good. Yep.
Perfect. Thank you very much. Okay. So now that I am done with the insulin, I will make a label of the insulin, writing down the concentration as well as the dose, date, time, and my initials. So okay. So before I administer that, don't want to cover anything up, so I'm just going to put it at the bottom. Perfect. So we got our insulin drawn up. I'm going to put that over there. Since I touched my pencil, I'm going to do some hand hygiene again. So now we'll do the influenza vaccine. So first I need a needle, as well as a syringe. Not turning my back on any of the meds. Probably should have done this before actually drawing up the insulin, but it's still within sight. All right, so pop this cap off. Swab the top of it. Perfect. needle onto the syringe. Oops. Just leave that there. Alright, so now pop off the cap, push some air into the vial, get it swabbed off the top. Now I'm ready to draw up 0.5 milliliters. There we go. Let's try that again. There we go. So we're going to draw up 0.5 milliliters. Try to get rid of that bubble. Oops. So now that that is gone, I will recap with the vial so I don't hurt myself. Oh, if the cap can stop running away from me. There we go. Alright, can I have you confirm that is 0.5 milliliters?
Mm-hmm.
Perfect, thank you. So now I have the flu vaccine drawn up. I will make the label, set that off to the side. So, we have the influenza vaccine. .5 milliliters. Should have included in, I don't remember if I said this, but would have included on the insulin label that it's a sub-Q injection. Alright, so influenza vaccine, 0.5 milliliters. I'll put the date, 10, 15, 19, time, and my initials. Perfect. So now, label syringe, again not covering up any of the numbers. Perfect. So now before I go into the patient's room, I'm going to do my second safety check. So I have the hydrochlorothiazide, the captopril, also double checking the 6 patient rights, so the right medication, the right patient, the right dose, the right route, the right time, and right documentation, which will be afterwards. So, already checked the hydrochlorothiazide, 50 milligrams. That is not expired also. Got the captopril, 25 milligrams. Excuse me. We have the NPH insulin, as well as the regular insulin drawn up. Same vial, or syringe. And then we have the flu vaccine. Perfect. And then also before I would give James his oral meds, I'd also check his vitals, like his blood pressure, since they are blood pressure meds. Also his pulse. Yeah, the vitals. Okay, so now I am done with preparing my medications. Sorry, words are hard. So we don't need that. We have the other 4. I'm just going to double check because I can. Alright, so we got everything. Perfect. So now I will grab any supplies that I need, such as some alcohol swabs. I don't think I'll need this many, but I'm still going to grab some just in case. I'm going to keep that there. Also, I would grab any gauze pads, but I don't see any here. But in the real world, I would grab gauze pads after injecting and stuff. Okay, so now we're going to go on to the patient's room. I'm just going to hold on to this. I'll come around and knock as if I was going in through the door. Scooch this over here. Okay.
Come in.
Open the door. Hello, James. My name is Chelsea, and I will be here to give you your 8 a.m. medications today. Can you tell me your name and date of birth?
James Wilson, May 12th, 1952.
Perfect. Also, I would have grabbed the MAR along with me to the patient's room. Just a side note. So I have his MAR. Okay, so he told me name and date of birth, the 2 patient identifiers. I'm just going to set this on his little side table, not keeping it out of my reach. I would have double checked his patient wristband to confirm those patient identifiers. I also see that he has an allergy to NSAIDs, which I already checked before. I'm not giving him any of those, so that's good. All right. I'm gonna wash my hands. All right, James. Do you have any questions before we begin?
Nope.
Perfect. And then I'd also make sure he's in a safe position, ensure safety, privacy, close the curtain if need be, shut the door after walking in. Alrighty, James. So, I would also check his blood pressure, pulse, all those vitals, just to make sure he's doing okay. Let's see. Then I do my last med check at the bedside. Okay, James, so first we have 2 pills that you get to take. One is hydrochlorothiazide. That is just to help regulate your blood pressure. And I would take them out of the package and dump them into the med cup. But I'm going to reuse these, so I'm just going to pretend that I did that. It's also doing my safety check. Captopril, 25 milligrams. Cool. Second med we're going to give you is the Captopril. It is also a medication that'll help regulate your blood pressure. And then we also are going to give you your insulin. So just to double check on the insulin, making sure I got the right label. Perfect. So yeah, we're going to give you your insulin in your stomach if that's okay with you.
Mm-hmm.
Perfect. And then we're also going to administer a flu shot today. You're still okay with receiving a flu shot?
Yes, ma'am.
Perfect. Thank you. All right, and that'll just help prevent you from getting the flu, because nobody wants that. And then your insulin will just balance out your blood sugar levels. All right. So once more, do you have any questions before we begin?
Nope.
Perfect. Sounds good. So first I will administer his oral medications and make sure he has something to take them with. Now, James, are you okay with drinking this water with your medications?
Mm-hmm.
All right, perfect. Then I either dump them into his hand or directly give them to him, whatever he prefers. And then make sure he has some water to wash them down with. Make sure that he takes both of them. Make sure that they don't fall out of the cup onto his gown or on the floor. So, You did take both of them, so we're good on that. Excuse me. So now, James, we're gonna give you your insulin and your flu shot. Do you care which one you get first?
Doesn't matter to me.
All right, perfect. So I'm just gonna do some hand hygiene again. All right. I'll grab my gloves. Perfect. So now we are going to take the alcohol swab and swab at the site. First, I'd assess his skin for any wounds. First, I tell him. So I'm going to give you your flu shot first, and that'll go in your arm, your deltoid. So I'm going to lift up your gown. So now I would assess for any wounds, any swelling, bruises. If that were the case, then I'd switch to the other arm in a place where that is not present. Okay, so I would find the acromion process and go 2 fingers down. Then I will take my alcohol swab if I can get it out. Swab the area from inside to outside. So now we'll go back to the injection pad because I'm not going to inject the mannequin. Okay, so again, go from inside to outside. And this is an IM injection. So we'll go at an 90-degree angle, finding that acromion process, going 2 finger widths down. All right, James, have you had a flu vaccine before?
Yep.
Perfect. So you kind of know how it goes?
Yep.
All right, so you'll feel a slight poke, and then it might sting afterwards, but it should be pretty quick. Okay. On the acromion process, 2 fingers down, stabilize the skin. All right, ready, James? 1, 2, 3. And then I would inject the fluid into him, but I'm not going to actually do that. So I'm going to recap the needle and dispose of it. Also, if I did have the gauze pads, I would just put some pressure on that if there was bleeding. Also, I forgot to mention, I would aspirate before injecting the medication just so I'd know that I didn't hit a vein or anything. Okay, so we got the IM injection. All right, James, let me pull down your sleeve one more time now that we're done with that. Okay, so now we'll be giving you your insulin. So this is going to go in your stomach. Is that okay?
Yep.
Perfect. As long as it's in the subcutaneous tissue. So I would, I'm going to lift your arm here quick.
Okay.
Would only expose the site of injection, whatever is necessary. I'm just going to rest your arm up here. So we just expose this much. Cleaning from inside to outside. Perfect. And then we'll go back over to the injection pad. And again, because we can't be too clean, I'm gonna clean it one more time. Okay, so going from an inside circle to outside circle. I will take the insulin. Make sure that is out of my way. Okay, James. So again, you'll feel a slight poke, maybe some burning, but it'll be over pretty quickly.
Okay.
So I will take off the cap. I will pinch an inch, and either go at a 90-degree angle or a 45 with the bevel facing up. Alright, so I'm going to go in at a 45. Ready, James? I'm going to inject in 3, 2, 1. Perfect. And then I'd take off, stabilize this, and inject it at a slow rate. But since it's just an injection pad, I'm not going to actually inject it. Alright, James, we are done with that. Dispose of it immediately. And then take my gauze pad, if there were bleeding, put some pressure on that as well. Alright, then make sure the bleeding is under control after that. Alrighty, James. So we got all of your medication done. And I would go back to him. Ooh, I'm sorry.
It's okay.
Okay, so cover his stomach back up. So now I'm going to just clean up my mess a little bit here. I can get my gloves off. There we go. Perfect. So now, gonna perform hand hygiene one more time. All right, James, how are you feeling right now?
I'm doing okay.
Perfect. Glad to hear that. So I'll be back in about 15 to 30 minutes just to check up on how you're doing. Does that sound okay?
Sounds good to me.
All right, perfect. So then, if you were in a bed and if I had moved the side rail down, I'd move that back up. I'd make sure his call light is in place. So I'll just take it off the wall, hand him the call light. Clean up my mess. Now, I almost forgot, I will document my medications. Thank you. Okay, and I'll just set that there. Okay, let's see. So, it's 8 a.m. on 10:15. Now the insulin. And it also state, oops, what am I doing right here? Wrote combination of the date and time. Okay, so I would also write down the site of the injection. So 800 sub-Q, the right side of the stomach. Again, for this side. Also writing the date as well. And oops, that was not the sub-Q. Jumping ahead of myself here. Okay, so for the influenza vaccine, I'd say that I administered it into his left deltoid. Perfect. I'll put my initials. Okay, so now that I got the documentation done, and one more time, just double check that he is safe, he's comfortable, make sure he's not in any pain. James, are you in any pain right now?
Nope, I'm good to go.
All right, perfect. I'd also make sure he's not in any pain before coming in and giving him his meds too. Remember if I said that. But, let's see. Gave him his call light. ask him, is there anything else I can do for you today, James?
Nope, I think I'm good. I'm gonna take a nap.
All right, sounds like a good plan. Well, I'm gonna come back in about 15 to 30 minutes just to double check and see how you're doing. Other than that, gas call light. Just trying to remember if this is the end. Okay, so I did my documentation, cleaned up my area, and we're good to go.